Right, now we want to actually establish a link, right, like a link between the respiratory system and congenital heart disease. We're trying to say when a baby is developing, the baby could have some issues with their respiratory system. Now these issues could contribute to this baby also having issues with their heart. Do you understand? So we want to actually establish a link between these two systems, how they can actually affect each other, and it's vice versa. Do you understand? Because if you look at this image I have here, the respiratory system could actually have, some effect on the heart. The heart could also have effect on the respiratory system. Of course, you can see that the two systems are very close. So now let's look at it. Now see that congenital heart defect is anything that has to do with the heart is not developing properly. So the heart's anatomy is abnormal. Do you understand? So the respiratory system can play a lot of roles in bringing up these complications. So why it doesn't directly cause it, do you understand? It can actually contribute. Do you understand? So developmental interplay between heart and lungs. So shared embryological origin. So the heart and lungs, they develop in close proximity during early gestation. Any disruption in the signal pathways, like all those neural crest migrations, can affect both systems. Okay. Pulmonary vascular malformation. So abnormal development of any blood vessel that links to what? The lungs. Okay. We usually cause issues in the heart because the oxygenated blood is supposed to move from the heart to the lungs. So anything that is obstructing this pathway, it can cause issues on the two organs. The lungs is not receiving what they want. The heart is having like a congestion because it's not able to send what it wants. You get. Then respiratory system related factors that usually influence congenital heart defect. So low oxygen levels during pregnancy usually cause issues in the heart of the baby. Pulmonary hypertension in newborns. High blood pressure in the lungs can worsen left to right shunts, leading to heart failures. Airway compressions from enlarged heart structures. So the heart is kind of like resting on the respiratory system. If it is too big, it can compress it. Do you understand? So the systems, they can affect their self, vice versa. So cardiomegaly or abnormal vessel positioning can compress airways. Restrictive airway disease. Then children with congenital heart diseases they usually have issues with what? Their respiratory system. Like it mostly goes hand in hand. Do you understand? So postnatal complications of what? Congestive heart disease. So pulmonary dysplasia is seen in premature infants with congenital heart disease, okay, who require prolonged ventilation or have ventilator-induced lung injury. Okay, so like if the baby is like you are helping the baby to breathe, like all those you are putting all those air marks, all those machines to help the baby breathe, it can lead to their lung damage, yes, and worsen the issue. The pulmonary edema, so left-sided defect, okay, backflow of blood into the lungs usually cause what? A fluid buildup. Okay, so this is just the most we can do in trying to link the two systems, just for you to know that issues here can affect this one, issues in this one can actually affect the other. Okay, so that's it for this.